So now we're going to move on from classifying joints by function, how much they move, to by their structure, or what's actually holding them together. And for the structure, there's three types of classifications. Fibrosis, which is going to have three subcategories to it. Cartilaginous, which also has three subcategories. And synovial, which are just going to be synovial joints. So if that was by function, we can also classify joints by structure, and we're going to spend a lot more time on this because we can break them down in a lot more detail. There's kind of three general categories for structure. The first are called fibrous joints. In these fibrous joints, there's going to have solid fibrous connective tissue. So think of it like dense CT, dense irregular or dense regular CT. You're going to see that in specific areas. Up in your skull, you'll see it up here, and then down here to your tibiofibular joint, you're going to see it down there. And I'm going to blow these up in a second and give you some more details. We've got cartilaginous joints, which are basically held together by cartilage. That can be either hyaline cartilage or fibrocartilage. These are going to be amphiarthrosis, meaning they can move a little bit, but not a whole lot. And synovial joints, going to have a joint capsule, synovial cavity, they're going to be diarthrotic. So you can see that a joint can be given two different names. And they almost match up one-to-one, but not quite. And I'm going to show you some of these differences. So the fibrous joints, and I don't think I mentioned this on the other slide, they're all going to be, if you look at them functionally, they're all going to be synarthrosis, meaning that they're pretty much immovable to slightly immovable. But here we're classifying them as far as how they're structured. So a fibrous joint is either going to be a sutural joint, a syndesmosis, or an interosseous membrane. So we're going to look at each of these three. Suture joints, we've already talked a little bit about. Those are those joints in your skull between the bones. They're going to have a little layer of dense irregular CT that you can see over here. They're immovable to slightly movable, just barely, and it's kind of some people have a debate about this. They'll say children maybe have a slightly more movable bones between their skull bones. There's a whole branch of physical therapy devoted to craniosacral therapy, and that's looking at the cerebrospinal fluid buildup and how that causes a pulsating kind of pressure within the cranium and spinal canal there. And that can cause those bones to move a little bit, but again, that's more theoretical, I think, and some people use it to practice with, but I don't know really enough to say about that. Syndesmosis, next kind of joint, we're looking at what's going on in the tibfibia and the gomphosis. And I'm going to point this out. I'm going to just highlight this here in red. When we're looking at the tibiofibular joint, we're really talking about this part right in here. So there we've got dense irregular CT. And that's going to provide very limited movement at that point. We also can see it in the teeth, where we've got this little joint here that's holding that tooth in, and we've got some dense irregular CT. This is called the gomphosis, which is being held in the mandible or in your maxilla. And here you're going to have your alveolar processes that you learned about sticking up here, and that's what's going to be holding in that tooth. So again, very limited movement, dense irregular CT. And then the last one is our interosseous membrane. And now you're probably looking at this saying, wait, we just saw this picture right here. And you kind of almost did. But the interosseous membrane is really a membrane. So it's kind of like saran wrap going between these two bones. And you'll see that right here. You can see all of these little fibers joining the tibia and fibula going through the length of the bone. And it just looks like a really clear, thin sheet. It allows a little bit more movement, but it's still pretty dang slight. And you'll see that between the tibia and fibula, which we have drawn, which we have shown you right here, and also in your forearm between the radius and ulna. So then we can move on to, those were fibrous joints. Now we're going to move to cartilaginous joints, and there's three types of those that you're going to see here. So in this case, the bones are being joined by cartilage. And again, they offer little to no movement. So these are going to be kind of like your amphiarthrosis joints. So we've got three of these guys. The first one is called synchondrosis. So syn again means with or together. And this is where our hyaline cartilage is going to come in. And we'll see a little bit of that hyaline cartilage here up in the ribs. So we'll see between the manubrium and the first rib, for example. It's going to allow very little movement, again, amphiarthrotic in nature, but synchondrosis because it's holding those together. None of these are going to have a joint capsule around them, remember that. We also have symphysis, and a symphysis is using a fibrocartilaginous disc. So we have those fibrocartilaginous discs or pads. We'll see those here in your pubic symphysis. We'll see those in the intervertebral discs that I was showing you on the slide before. Again, it's going to allow for slight motion, and these are two great examples for you. And the last one you probably wouldn't have thought of at all as being a joint, and I didn't for a long time. It's the epiphyseal cartilage. So that's that epiphyseal plate that we saw on our long bones, and technically that's a joint. But instead of being amphiarthrotic, this is definitely going to be synarthrotic, because hopefully the head of your femur here is not going to be moving at all on the neck or the shaft of your femur. Same with the greater trochanter. So these guys have no movement, and it's just that cartilage, that growth plate in here. Okay, this is our last joint. We're joint type or classification. We're looking at synovial joints. So synovial joints, I say, range from being slightly movable. You'll see that like between the bones in your wrist, those carpal bones, to supermobile joints like at your shoulder or your hip. These synovial joints are all going to have a few common characteristics. One, they're going to have an outer capsule, and this is something you're going to need to be able to draw. This drawing right here, I really like, and it makes it really nice and clean. So you need to be able to draw this and understand each component of this joint. We're going to have this outer capsule here, which is being called the fibrous membrane. That's going to be made of dense, irregular CT. It may also have some ligaments kind of weaved into it, and we'll see that especially with the medial collateral ligament. You're going to have a medial collateral ligament on one side and a lateral collateral ligament on the outside as you're going further away from midline. So you're going to have this outer capsule, and then you're going to have an inner capsule, which is here in red. And that inner capsule is going to be our synovial membrane. And if you remember, that synovial membrane is going to secrete synovial fluid. And that synovial fluid is that clear, kind of jelly-like fluid that kind of looks like the whites of a raw egg floating around in there. And that fluid is going to be able to nourish the chondrocytes, which are the cells that help to build up the cartilage that's in there. That capsule is going to act to be a part of a shock absorber. It's going to lubricate the inside of this joint, especially where all this hyaline articular cartilage is. And that articular cartilage is what we're going to see next. That lubrication is going to make it have less friction, so it'll slide on each other a little bit easier. Of course, we've got the articular hyaline cartilage at the ends of those long bones. And remember, there's no periosteum around that articular cartilage. The periosteum exists everywhere except where there's articular cartilage. So this articular cartilage is doing all three of these things. It's absorbing shock, it's decreasing friction, and again, it's covering at the ends of those long bones. And then we're going to have all the inside, the space of this thing. In that joint cavity, we're going to see there's going to be fluid in there that's going to, of course, nourish the chondrocytes, be a shock absorber, and lubricate, just like what we saw. That fluid's coming from that inner capsule that is a synovial joint membrane. So for our last slide on this, we're just going to look at some accessory structures that are not critical or always in a joint or in a synovial joint, but they're going to help that joint to provide it with some stability or allow things to actually slide and move a little bit easier. And that first one is our synovial fluid coming from that synovial membrane. Some joints will have a little articular fat pad in there to help cushion some of that blow. There'll be accessory ligaments, And those ligaments can be extracapsular, meaning outside of that joint capsule, or they can be intracapsular, meaning within the capsule. So when we look at the knee, we're going to be able to see both of these. The ACL and PCL are intracapsular joints, meaning they're within the joint, and the MCL and LCL are going to be outside of the joint or meshed in with that fibrous joint capsule. Many joints will have articular discs. In the knee, we're going to see that's going to be meniscus, and you've got a medial and lateral meniscus. You've got articular discs up in your temporomandibular joint, up in your jaw, in your intervertebral discs, obviously, and lots of different types of discs throughout your body. Some joints have what's called a labrum, and a labrum is a fibrocartilaginous lip of the socket. So you're going to see one, especially at the shoulder joint here, the glenohumeral joint. You can see a labrum, which is a little piece of cartilage that's coming out and providing a little bit more support around the head here. And you can see a strong labrum down in the hip that's going to help to support the hip joint. Now last up here, we've got these little bursa. And bursa are like little pillow sacks filled with synovial fluid. And what that's going to do is it's going to allow for, again, a little bit more cushioning, especially in areas that may be going through some harder impact. It's going to help to reduce a lot of friction in there. And then to kind of go along with bursa, we're going to have these tendinous sheaths. And these tendinous sheaths are kind of like tubes of bursa that wrap around tendons. And so in this shoulder joint, you're looking at the biceps brachii long head. And this tendon goes right up around this humerus and attaches to the supraglenoid tubercle of the scapula. But as it does that, it needs to be able to slide easily around that head. So it's sitting in this little tube that's got synovial fluid within it, and it's going to allow that tendon to slide back and forth easy. So these are all accessory structures of the joint. Two more I'm just going to throw down here that are really not part of the joint, but you'll also often see them around. Is going to be either these tendons or their aponeuroses. And remember, the aponeuroses are like a big web extension of a tendon. So you'll see that in the palm, the palmar aponeurosis, or in the abdomen, where those abdominal muscles all come together in the middle. So you'll see a big white, wide sheath there. Then, of course, we've got blood and nerve supply. So that wraps up the structural and functional classifications of these joints. This is the hardest part of this whole chapter. So take some time. You're going to have to write these things out, put them on flashcards, and once you see how they're classified, they'll kind of make sense. And then we're going to go through each of the joints after we detail out these synovial joints just a little bit. We're actually going to get a little bit more detail on these synovial joints, and then we'll look how they all move.